once you get engaged in any creative process,
is an opportunity of healing with the arts. Hi, I'm Mary Rockwood Lane, and I would like to tell you my story of how art changed my life. I was a younger woman at the time. I was a young mother and a nurse, and I had 2 small children. And I went through a period where I became very depressed and very ill. And my husband left me, and I was shattered. I was outraged, I was depressed, and I became physically ill. And I didn't know what to do with myself at that time in my life. All I did was cry, I was ashamed, and I was isolated. I had a friend who was an artist who came to me and said, "Why don't you come to my house and start making art?" I'd never done it before. I never felt good enough. But I decided, since everything else in my life was a mess, what difference does it make that I'm not good enough to be an artist? So I just decided to start making art. And what I found out is through my art, I could express myself without hurting anyone and without hurting myself. I could be as outraged as I felt, expressing myself through the canvas. I could paint, cut out my heart. I could paint myself distorted. I could paint my despair. I just was this visceral release to where I just put on music and I just let myself go. And what was amazing about the experience, I kept doing these self-portraits of myself that were so painful. But every time I painted one, I suddenly would look back and realize I expressed myself totally authentically, fully, and it was amazing. I didn't feel it anymore inside me. It was like when I got it out on the canvas, I was able to look back and witness myself and in a way have compassion for myself that I was going through such a horrible experience and I was so devastated. Well, after a while, I kept painting, and I discovered through painting that I loved it, I was passionate about it, and I started to evolve into an artist. I never thought I could paint before, and I was doing these figurative pieces, and I suddenly realized I loved this, and I started painting more and more. And one day, I went into my studio after I had painted like 8 series of portraits, and I looked at this painting of the most recent portrait I had painted, and I was calm, I was healed, and I was strong. And then I looked back at the portrait that I first painted, where I was distorted, cut out my heart, I was in so much pain, I was crumpled, and I looked at it and I thought, I'm not that woman anymore. I am now healed. And I realized the artist that I had become was also the part of me that had actually healed me. That I discovered something in myself that I never knew that was there before. That I could paint, and the painter in me painted myself strong. It was unbelievable. I was so excited. I was on fire. And I got so excited. I thought, well, if everyone's an artist, obviously, because I was not an artist before I started this, so that means everyone's an artist, and everybody who can make art can tap into the healing power that is within them. And if we bring art to people and we invite them to make art when they're suffering, when they're in despair, and when they feel broken, that through this transformational journey, they can heal themselves and they can activate things inside themselves that they never knew were even there in the first place. So the timing was unbelievable. In 1991, I got a newsletter from a doctor called House Calls. And it was Dr. John Graham Pohl who wrote a letter to all the doctors in the medical community talking about arts and medicine and how he had a vision of integrating the arts into medical education. And I thought, oh my gosh, this is fantastic. I got to go meet him. So I made an appointment to meet with Dr. John Graham Pohl, and I told him about my experience. And I said, this is amazing. I think we should start an artist in residence program and invite artists in Gainesville and ask the artists to come in and let's explore the ways and we can integrate the arts into healthcare. He said, what's an artist in residence? I said, I don't know. It's going to happen. We're going to make it happen. They're going to come and they're going to emerge and we're going to know it's possible if we bring the artists in and we invite them. And if we meet with the nurses and the physicians in the hospital and the other caregivers, we can create something that's never happened before. And he was so positive. So I met with the head nurse on the bone marrow transplant unit. Her name was Helen Walsh. And I talked to her about this idea, and since I was a nurse and she was a nurse and John, the medical director of the bone marrow transplant, was on board, we decided we'd try it out. The bone marrow transplant unit was where patients came when it was the last therapy on the end of their journey of dealing with all the other cancer treatments. So half the patients on the bone marrow transplant didn't make it through the treatment. So it was a very, very challenging unit to start on. And back then there was isolation and there were all these rules and it was very challenging. And I thought, if there's any place we can learn and we can start, it's going to be here on the bone marrow transplant unit, because it's an intensive care unit. And not only did the patients and families need something, but so did the staff. So they gave us permission to start this artist in residency program. And at that time, John Grampole and I went to the CEO, Paul Metz, and we told him about our vision of starting the arts and medicine program. And it turns out his wife was the first artist, because his wife would come in and do quilts with patients at the bedside. So he understood in his heart what it could be. And he gave us a small budget so we could start getting art supplies and start calling artists in and start having artist retreats and start exploring this new frontier of how we could integrate the arts and artists into healthcare. It was right at the very beginning. No one had done this before, but I was so passionate. And John was so passionate because he was a clown and he was a poet. And he really was excited about bringing the arts into the bone marrow transplant unit. So we began. We began with a small group of artists, and we began working with patients at the bedside. And we worked slowly, and in the very beginning, we bought all these art supplies. And what we realized is that sometimes the artists, the patients made art, but sometimes they didn't. We started in the very beginning to work with staff, nurses and physicians and the social workers, so they could tell us what was possible. What were the possible creative activities would be integrated into clinical practice. Then from there, we started doing workshops for the family in the family waiting room and doing different art shops and making dream catchers, making mandalas, doing collaging, making pottery. And then the family member would say, would you come in and see my sister? Would you come in and see my child? And that's how it began. We began very slowly. But what we realized is that when we bring music in, when we bring art supplies into a room, when we invite patients and family to make art, even though they don't think they're artists, with an artist right there holding the space for anything creative to manifest, something magical happened. And it wouldn't have happened without the sacred space of the clinical practice of the nurses, because it was the nurses that were providing the health care and really taking care of the patients, which allowed the artist to simply make art. Just sing a song, just write a poem, just dance. When you're in this environment and patients were so sick, there were healthcare providers all around that took care of the needs of the patient so the artist could be in that relationship with the patient. and it started something new. We weren't doing therapy. What we were doing was simply making art. And artists from all over the country started to come. Jill Sankey Henderson was the first dancer in residence. She came from New York City, and she came in and she created a dancing program. She became the first dancer in residence, and she worked on the bone marrow transplant unit. Then there was Kathy DeWitt, who was a musician in town. She came in and bought a piano and started a whole musician program. And she's been working there for 30 years. And we had strolling musicians going through the hallways, and we had concerts down in the atrium, and now we have pianos in every one of the buildings at the UF Health and Shands. And then Mary Lisa was an artist who started by painting t-shirts for patients and hats for patients. And she ended up blossoming, becoming an artist in residence for almost 20 years. And she ended up making mosaics throughout the hospital. And she brought in the arts. And then we had a new artist, Leanne Stackpole, who was actually my friend, who invited me to her studio. And she was the person who put the art supplies in front of me in her studio and said, "Mary, make art. You've got it in you." I invited Leanne to come in, and she created a studio in the Cancer Center where we invited patients and families to make tiles. And staff made tiles. And now there's 1,600 tiles. And she ended up creating the healing wall and putting mosaics all around it. And it was the first time visual art became apparent, because we had been making art at the bedside for many, many years. But what was also remarkable during that period of time, PBS came, Ivanhoe Television came, documentaries were made, and suddenly people were interested in what's going on at the University of Florida. What is an arts and medicine program? And they started filming artists working at the bedside, and filming dancers in the patient's room, and filming concerts in the hospital. It became so large that the governor's wife at that time, Jed Bush was the governor of the state of Florida, his wife, called me up and said, "I heard about this program, Arts and Medicine. I'd like to invite you to the governor's house, and I'd like you to create a workshop for the wives of all the representatives in the House of Representatives." And I said, "Sure." So we went up there and we did this beautiful arts and healing workshop. And then she came down to Shands and visited the artists and the patients and the families at the bedside. This is an incredible legacy that is here at the University of Florida, that has touched thousands and thousands of patients and families' lives. It has also become a model for arts and medicine programs all over the country. And I was so honored to be there at the right place, at the right time, when this star was being born. And it has been the most incredible journey for me to make art in my studio, crying, feeling like I was destroyed, and discovering that I was an artist. I could paint, that I was so inspired because of being a nurse. I wanted to bring it into healthcare. And this is my personal story of how I truly believe when we tap into that wellspring of creativity in our lives, we have no idea the destiny that we are opening up to manifest in our lives. And I know each and every one of us has a destiny. And through activating our creativity and reclaiming the artist that each and every one of us an artist, that it is unbelievable how you can bring your art into the world and make a contribution. Make a contribution that is beyond your wildest imagination. You never would have dreamed it would be possible. A couple years ago, when I went to the Society for Arts and Healthcare, I walked into Houston, and there was art on the walls, and there was musicians, and there were clowns in the intensive care unit. I was walking around like I had landed on a different planet, and I was like, I felt so small, but I felt even in this huge world of arts and medicine manifesting itself, I thought, oh, I am so lucky that I had a small part of making this incredible movement in the world. Thank you for listening to my story. Thank you for your interest in healing with the arts. And thank you for being part of the star cluster that's manifesting this work in the world. Because when I started this program, I had a dream. I went to the springs, the Itchituchee Springs here in Florida. And I remember being at the spring, and I remember thinking, there's this world of arts and healing. And I saw all these beautiful silver threads going up into the sky, attached to all the stars in the sky. And I said, these are all the people that are going to bring this work to life and bring this work to life. So thank you for you being a shining light in this world. I am honored that I had anything to do with the possibilities and the potential of what it will become. And I want to say thank you from the bottom of my heart for the light you bring to the world.